All right. So welcome everyone. This is Niagara Pride's Lunch and Learn series. Today is June 18th, 2021. And we have two panelists. We have Sam from Elderwood and we have Rebecca from Venture Forthe that will be talking about their programs today. And we're going to start off with Rebecca. And if you don't mind, introduce yourself, tell us a little bit about yourself and the programs that you do. Thank you. So Rebecca was able to share her screen moments ago, and then I asked her to stop sharing her screen. So that probably has resulted in technical difficulties. So totally my.
No, I'll wing it. I'm fine with it.
Are you sure?
Yeah, absolutely. I'm fine.
Okay.
It was there though. I'm not losing it.
It was. Okay. We totally saw it. It was really okay. There.
So we are a personalized home care agency. We specialize in PCA services, CDPAP services, TBI waiver programs, NHTD waiver programs, and HCBS services. And I'm going to break them down a little bit. So CDPAP is where we pay a loved one, family or friend to take care of the individual in their home with specific daily life activities, which may be meal prep or bathing, and we have a higher level of care, which is like the PCA. The PCA is individuals that we train and we link up with the client. We also have someone on staff, her name is Robin, that will do the Medicaid app. And we actually walk them from the point of getting Medicaid to the point of service. We walk them through the whole program. Obviously, it's free of charge. TBI waiver program, this is someone that needs a higher level of care. So anyone that has, same thing with the NHTD waiver, anyone that has like any type of cognitive impairment, if they had a stroke, if there's some diagnosis of dementia or Alzheimer's or so forth, we can put in a request into what's called the RRDC and potentially get them 24/7 care, which is really huge. So when I get a referral, the very first thing I do is ask them, is there any cognitive impairment? Because we want to make sure that they're getting the services that they need. A big one that plays close to my heart is the HCBS services, which is home and community-based services. So this is for individuals that are HARP eligible. HARP eligible is it's New York State, through the insurance company, determines someone that has significant mental health or substance use issues. They determine them to be HARP eligible. And that is with like consistent inpatient visits and stuff like that. It's every month they update them, but it's a Medicaid plan. Medicaid funded, and we have different programs through that, and that is we have vocational, educational, employment, we have community psychiatric supports, we have peer supports, you name it, we do all the different services, and this is a great program. It's near and dear to my heart, and I think it's amazing because we are doing in person compared to a lot of people are doing virtual still. So I think that's roundabout way of getting everything covered.
No worries. Can I ask you a couple of questions?
Absolutely.
Easy questions. So first question, since we are Niagara Pride and we focus with the LGBTQ community, a lot of programs don't necessarily have very specific LGBTQ programs, but are LGBTQ affirming. I'm assuming that is the case with Venture Forthe, that you offer affirming services. So anybody, whether they're LGBTQ
absolutely,
or
absolutely,
very
absolutely.
Cool. And what would be the best way to, if somebody needed your services, how do they link up with you or your agency, and how do they get that process going?
Okay, so the contact for Niagara, specifically Niagara County, would be, her name is Melissa Peck, and she can be reached directly through her phone number, which is 716-475-0074.
Perfect.
Yeah, and she'll take care of everything.
All right. And is there a website for Venture Forthe?
Yes. Yep. And on the website, there's lists all our different services and tells you a little bit more about our company. Because our company basically started, I believe it's I want to say 93, it started in Erie County. It officially started. It was actually by an old drug and alcohol counselor. He started the TBI waiver program because there weren't programs available. And then we just kept growing and growing. It's a family owned and operated business. And that's what I really like about it.
Awesome. Little bit of a side note. This may sound like a weird question. Is there an individual still named Chris, taller, red-haired gentleman that works there? He would probably be in the in the administration at this point, if he's still there.
Arillo. I got Chris Arillo, Chris Roche.
Maybe Chris Roche. CRC. He and I went to school together, so I have my CRC. And so I applied for a job once actually with Venture Forthe, but ended up turning down the position because I got offered something else. So, but yes, you guys do great work. So I'm very familiar with Venture Forthe. And I do want to say you guys do incredible work. And with my background in CRC, which is Certified Rehab Counseling, one of the things that I specialized in, or that I was trained in, was TBI, so traumatic brain injury. And so that's why I applied for agency, to be able to work with individuals with that. So it is an incredible program. You guys do incredible work. I can't say enough about it. So yes, if anybody has questions, please go check out Venture Forthe for any of those programs that Rebecca talked about. So thank you. Yes, no problem. And so next we have Sam, and Sam is from Elderwood. So please tell us about your program and you.
Awesome. All right, I'm going to share my screen here. Can you guys see this okay?
Yes. Yep.
Excellent. All right, everyone. So hi, thank you so much for listening in today. My name is Sam. I work for Elderwood Health Plan, manage long-term care. A little bit about me, I've been with the company for about 2 years now. Elderwood Health Plan has a great reputation in the community. Please always use me as a resource. I'll share my contact information at the end as well too. But yeah, this is, I'm going to go through a PowerPoint today just so you get a better idea of what we provide and how we can help you. So I'm going to go over the eligibility first. So to be eligible for a health plan, you do need to be 21 and older, and you do need to reside in one of our 6 counties. So currently we're in Erie, Niagara, Genesee, Orleans, Wyoming, and Monroe County. The biggest component of our plan is hands-on care. So say you or a loved one need help with cooking, cleaning, bathing, dressing, you need to accept that hands-on care, transferring, like I said, bathing, dressing, that's what's going to qualify you for the plan. Now, how our services are paid, they're paid through the Medicaid. So you need to be Medicaid eligible. A lot of people that typically are on our plan do have Medicare and Medicaid. And not to dive too deep into it, but a lot of people do have that component on our plan is because we're not a primary insurance plan. We're adding on additional benefits on top of your primary insurance. So Medicare will still cover your primary doctor. They're going to still, if you have Part D prescription coverage, they're going to pick that up still. So nothing's going to change. And I think that's a big misconception of managed long-term care is because people think, they're going to lose services. And that's what I try to stress with people. And that's really where my job comes is to really educate people so they have a better understanding. We're going to add on additional benefits to help you stay at home as long as possible. And that's, one of the biggest goals with managed long-term care is we want our members to age in place. We want people to stay at home. So that's where we'll come in. And I'm going to go through the benefits in a couple minutes. But yeah, a lot of people have the Medicare, Medicaid component. Just to add in too, if you do have let's say you come across somebody or you have managed Medicaid, which I'll go through too. What a lot of people don't realize is when they do have just managed Medicaid, you can actually receive all of the services through your managed Medicaid Fidelis, Blue Cross Blue Shield. The only services that you don't receive is home delivered meals and social daycare. All the other services that a managed long-term care health plan offers, you can actually get through managed Medicaid, which I'll go into more detail too. And the only other thing I want to touch on is we do look for people that need at least 120 days from the date they enroll in. So we look for someone long-term that will be on our plan. So keep that in mind as well too. So to get into the process of how do you enroll in? So first you're going to need a state assessment. Since it is a Medicaid plan, you'll first get a state assessment. I believe they're still doing those telephonically at this time due to COVID. That's what I've heard. So they'll give you a call. Basically, that nurse is going to just see if you qualify for the plan, if you need that hands-on care component piece. And as long as you're approved by the state, that's when, you know, our health plan will come into play, and we're going to give you an assessment with one of our nurses. I know the state too, they can usually get their assessment set up within a couple days, you know, so the process is very quick. When you get, you know, you can, again, it's free, you know, you can choose who you want. You know, there's us, there's Fidelis, there's Nessentia, there's iCircle, you know, so the member is free of choice. They can choose who they want. Say they chose Elderwood Health Plan. We have 3 excellent girls that do our enrollment. They really take the members through the whole process. So you guys will be in great hands. You know, we'll submit all the paperwork for you. If there's any little hiccups along the way, our girls will take care of it. Our assessments can usually get set up within a week. And I like to keep this in mind too. You know, we do have guidelines with managed long-term care enrollment. So we do need to get everything submitted in by the 20th of the month in order to enroll in for the next month. So say we got everything submitted in by today, you would be ready to go by July 1st. Anything that's submitted after the 20th will be put off to the following month. When our nurse does the assessment, they're going to go through a New York State scoring tool, which all of the plans use. And they're going to go through and they are going to see what needs you have. They'll ask you a series of questions, and based off your answers will be how many hours of aid service you'll receive. They also go through the other benefits that we cover as well too, which I'll go through in the next couple slides. There was one small, you know, there was one change that happened. I like to touch on this too. You know, as of December 1st, any new enrollment into a managed long-term care now will have a lock-in period. So this means if you decide to transfer from your MLTC Medicaid plan to another MLTC Medicaid plan on or after December 1st, you'll have a lock-in period. So basically what this means is the first 90 days after you transfer to your new MLTC Medicaid plan is a grace period. So when a person comes on our plan during the grace period, you can transfer from our plan to say Fidelis, Nessentia, iCircle. After the 90-day grace period, you will have to stay in that plan for an additional 9 months before you're allowed to move into another MLTC Medicaid plan. This 9-month is called the lock-in period. And I also have the official state letter too. And it goes through more details than just this. You know, of course, if somebody wants to transfer from one MLTC plan to another, and it falls within these guidelines, they can, you know, say they don't reside, we don't cover Erie County, and another plan does, you know, they would be able to switch. Now, the services that are covered under all managed long-term care plans, the biggest one is aid service. So, you know, they can either do the consumer directed program where, if you guys aren't familiar with that, which I know that Rebecca just went over it, but, you know, that's where a family or friend can be the caregiver. It's great. You know, if you already have someone taking care of you, they can receive a paycheck for that. There's more flexibility with that program. You know, that person is self-directing that's on our plan. Say they don't have that option and they want to go with a trained aide, you know, we can also put that in the home and pay for it. Durable medical equipment, anything medically necessary, the plan will pay for. A couple examples: wheelchair, walker, cane, oxygen. If you're familiar with the emergency response system, the necklace or bracelet, we pay for that. Another great thing is we schedule all non-emergent transportation. Our member service department, you just call into our health plan, we'll schedule all your trips. Say you're going to dialysis a couple times a week, we can pre-schedule that so you don't have to keep calling in. So that's one of the, you know, bigger ones I like to stress is that transportation. Podiatry, dental, vision, audiology. You know, we pay for hearing aids if it's medically necessary. Glasses, say they need dentures, we'll pay for that. Home delivered meals, if you're familiar with Mom's Meals, we pay for that. Social day. So these will be all the services that you'll be gaining. Again, paid with Medicaid, free of charge. Some people that are familiar to a spend down, say you spend, you know, you pay a spend down to the county, now you'll pay it to the health plan. But these will be all the services that you're going to be gaining. Now, say you have that Medicare and Medicaid component. These are typically a lot of questions people ask when they're looking to get on our plan. Who's going to cover my physician? You know, who's going to cover the specialist you don't cover? What happens if I end up in the hospital? That will also remain under your primary insurance, which is the Medicare. Like I mentioned earlier, if you have that Part D prescription coverage, that will fall still under your primary insurance. So nothing will change. You're just going to be gaining all of these services underneath your Medicare. Now, another change that happened too is as of January 1st, all plans now removed a service limit on PT, OT, and ST. So as long as it's medically necessary, you can get an unlimited cap of visits, which is excellent. And to touch too on our care management department, you know, we like that open connection. You know, we want to stay in real close contact with our members. You know, when the member does get on our plan, they'll get a nurse assigned to their case, which is huge. You know, the nurse will follow up with them monthly. Say our members get hospitalized, we get notified of that as a health plan. So we'll connect back with the member once they get safely home. Maybe now they need more hours of aid service. Maybe now they need a wheelchair. So we really want to make sure that we're proactive and really stay in touch with our members and keep that open line of communication. We have the on-call phone over the weekend if they need something. They can always get a hold of somebody. The communication is really what I like to stress with Elderwood Health Plan. You know, like I mentioned, we just got up to 1,000 members, which is huge for us. And we're super excited about that. And even though we're a smaller plan, we really, like I said, we really keep that line of communication open. We really want to make sure they're getting the care management that they need while they're on our plan. And then one last thing I do want to touch on is our provider network. We have a huge provider network. Our members have a lot of options. We just contracted around 2 years ago with HealthPlex, which is a huge dental network, which gives our members a lot of options, even in our rural counties. You know, when our nurses do the assessment, we want to make sure that all the doctors that they're already seeing are in our network. Our business development department, they work very hard to constantly bring new providers onto our network as well too. And yeah, and our members all get a copy of our member handbook and our provider directory. Also on our website, all the updated providers are on there. So if you're thinking of joining us, but you want to double check and see if a doctor accepts us or an agency accepts us, feel free to go to elderwoodhealthplan.com and take a look and see what we're about. And then I have my closing. But yeah, that's a little bit about me. If you guys have any questions, please feel free to reach out to me at any time. I will get you guys the main phone number to us in just 1 second here. If you guys need anything, please feel free to reach out to 716-631-1327. That is the phone number for Elderwood Health Plan. So if you guys have any questions, please feel free to get connected with our enrollment department. Please feel free to ask for me. They can connect you over to my phone. Again, if you need anything, please reach out. We want to provide the resources to you guys, and we're always here to educate you and help you along the way. Thank you so much.
Thank you, Sam. I'm going to ask kind of the same general question because, again, I think the type of service that you provide and Elderwood provides is maybe, again, not necessarily having LGBTQ specific, but it sounds like it's definitely affirming and that anybody who is within the LGBTQ community could call and access your services and not have an issue in terms of being turned away or anything like that for services.
Definitely. Yeah, please, anyone reach out to us. You know, we just really want to help you guys out. Make sure you have the resources that you need just so you can have a healthy, long life. That's why we're here. We want to help everybody in the community.
Awesome. And I just want to ask, it's kind of a question to both of you. And again, not necessarily that you would have to have like specifics or anything like that, but I just kind of, I wanted to ask because I know a lot of individuals in the community often feel that they're afraid to access healthcare because of either discrimination, or they don't know if the provider is maybe familiar with trans issues or gay men's health or lesbian health issues. And so I think a lot of times there may be a stigma or that kind of fear. If somebody has questions about that, are they able to ask? And also kind of on the back end of that, if there were issues, like if there was a provider that they maybe had an issue with, that they got a referral for, they went through one of you guys, and there was some sort of issue, are they able to report that to you? Is there something where you guys kind of assisted with re-referral or helping that individual so that they find a doctor or provider that they are comfortable with?
Oh yeah, definitely. And that's why too, you know, guys, like that's why we give you a nurse and a social worker on your case. So you have somebody that you can call, and we're always willing to work with you and help you out, you know. Yeah, and that's why we try to really stress with our members too, that open line of communication, so you feel comfortable to call us, you know, and confide to us in certain things. And we're always willing to help you find another doctor, you know, even if it's not something we cover, the social worker and the nurse, you know, they'll go above and beyond and try to find somebody that would better suit, you know, you, and so you feel comfortable.
Awesome. Very cool. Yeah, no, I think that is one of the biggest things. When we look at like the health statistics, there's a lot of individuals that either can't afford the healthcare that they need or are afraid to try to access that because of the stigma. And so it's always great knowing that there are programs out there that are affirming and that recognize those particular unique health needs. So it's great knowing that those are available to people and that those options are there. So is there anything else that you guys wanted to mention? Anything else you want our audience to know? As my dog is squeaking or squeaked. Oh, Lordy. The joys of working from home, I guess. That cannot be edited out. So, yes. So.
Yeah, I mean, the only other thing I would touch is, guys, please feel free to reach out to us. Use us both as a resource. And if you come across any other questions, of course, reach out to us for anything. You know, we may have a resource or somewhere to link you to, even if it's not necessarily for our program, but say we can refer you out to somewhere that would better fit your needs. You know, don't be afraid to reach out.
Awesome. Very cool. So, all right. So with that, I'm going to thank both of you, Rebecca and Sam. Thank you for being here today with us, for talking about your programs. We will make this recording available on our website. And if anybody has questions, we'll have the information. If you sent along any slides, we can post those slides as well as any handouts. If you'd like to share those, we'll make those available. So you can do that to our info@niagarapride.org email address. And I look forward to working with you guys in the future for other ventures. And yeah, definitely looking forward to it. So I can't talk, so yes. So just ignore me today. I'm a hot mess. So
it's Friday.
It is Friday, thank God. So very nice. Well, once again, thank you. Happy Pride Month, and thank you for being with us today.
Happy Pride Month. Thanks, Ron.
Thank you.
Bye, guys.
Yep. Bye-bye now.